Yes, I am, and I am proud to say that I received my board certificate 1 year after my training at Cornell, which was way back in 1983. Oh, it's now almost over 2 decades, approaching 3, about 29 plus years. I love my rhinoplasties, and I do rhinoplasty twice a week, on Tuesday and on Thursday. Surgery is serious business, and plastic surgery is surgery. Surgeons should be concerned about bleeding, infection, which we give preoperative antibiotics, and making sure that all the tissues are aligned properly and beautiful when the result is done. Anesthesia these days is so safe that most patients fly through nasal surgery without a hitch. Yes, I have. I'm proud to say that I've done extensive work on cleft lip and palate children years ago in Mexicali. I ran the burn unit at Cornell and the reconstructive unit at Memorial Sloan Kettering. So in an effort to become a board certified plastic surgeon, one must have had expertise in all of these subcategories, including hand surgery, replantation, breast surgery, and trauma surgery. Revisions are extremely rare. I am a very slow surgeon. As a result, I move along very deliberately with a lot of precision, and it's very unusual for me to have to take a patient back to surgery for something that needs revision. I will say that maybe once or twice in a year, if there's a little tweak I have to do to a nose or a face or a breast or an eyelid, I will do that, and it is always my responsibility. I attend Manhattan Eye and Ear Hospital, Lenox Hill Hospital, and the outpatient limb of Cornell. However, in our office, we have built a hospital-grade private operatory that is fully certified by the American Association of Ambulatory Surgical Facilities. Nothing was spared in its construction, and I am proud to do my surgeries here. Plastic surgery nationwide today has moved away from hospitals for so many reasons. A few could be cleanliness, having to share a room with someone who might be much sicker than you, the newest advent of MRSA infections, and on and on. In our own facility, everything is immaculately clean, and only the surgeries that I choose to do in my private facility are done. I think it's a smoother, more private, and well-controlled environment as opposed to a hospital situation. I use only 2 board-certified anesthesiologists. I do not use nurse anesthetists. I feel the highest quality care is given by those who have achieved board certification, and that's in anesthesia also. Anesthesia has come a real long way. No longer do we have to put tubes down into the lungs and deliver gaseous elements that may make you nauseated and vomiting when you wake up. In modern plastic surgery, the anesthesia is delivered through an intravenous line in your arm. You're given oxygenation for your lungs and brain, but it is the intravenous medicine that is so safe that you move through your nasal surgery without even know you have had it. And when you wake up, the surgery is over, and you will look at me and say, well, when are we beginning? And it's all over. Absolutely. About a third of my patients are refused for any number of reasons. Some, for example, could be a pushy boyfriend or an overwhelming parent. Um, Medical reasons like blood work that is not perfect before your surgery starts, medicines that I'm not told about that can cause platelets to disaggregate or produce untoward bleeding in the operating room, unrealistic expectations. It's very important in my practice that you bring in pictures and we study you and we study the photos you bring in so that when you wake up, you receive the nose that you really felt you were looking to have before the surgery. And it's not till all of those things check out do we move forward with the actual nasal surgery. In general, and in a standard way, I give 4 medications to our patients having rhinoplasty. One is a pain medication if you're in pain afterwards, and usually it's a moderate discomfort at worst. The second medication is to help you sleep so that you're not up and uncomfortable. The third medication is a broad spectrum antibiotic to avoid any kind of infection, which is also given by the anesthesiologist while you're asleep on the operating table. And the fourth medication is a medicine to reduce swelling. There are other medicines like arnica and bromelain that can also reduce and quicken the disappearance of bruising and swelling, and our office advises those to be okay as well. There should be no extensive scarring in rhinoplasty. Remember, there are only 2 routes to do nasal surgery through. Most primary nasal surgeries are done through the nostrils with no evidence of any scarring on the face whatsoever. More complicated noses, secondary and tertiary rhinoplasties, are sometimes done in an open fashion where there's a near invisible scar at the base of the columella, which is sewn together with my loop magnification. After your surgery, about 2 days later, we don't use packing anymore, but small sponges are removed. A nasal splint is constructed with heat-sensitive plastic, and that comes off at about 5 or 6 days. By about 6 or 7 days, you're able to put on some light makeup and enjoy a nice walk, even attend your school or job, but no excessive activity for about 2 weeks from the time of surgery. The reason for that is excessive activity can increase your heart rate, which increases your blood pressure, and if your blood pressure is increased, you're liable to have a bit of a nosebleed, and we'd rather stay away from that. If you have a large bony hump or a downturned tip or a bulbous tip, even before the splint comes off, you're going to be able to see through it, and you're going to be able to see an amazing change in your nose, even in its gross configuration before the splint is removed. The splint, of course, is removed at day 5 or 6, when you can really see the gross detail, and then the tapes at about day 7. Swelling continues to go away for weeks and months to follow, but by a couple of weeks, 10 days to 2 weeks, I think you're going to be very, very happy with what you see. It is very important in the preoperative consultation, as well as in your medical clearance, to be honest with your doctor about what you're taking outside of the office. There are all kinds of dietary supplements and homeopathic medicines that can thin your blood, disaggregate your platelets, and cause unnecessary bleeding. Seeing these pictures allows you to understand what my 10 fingers can produce in an operating room. We do not do computer imaging here because computers don't do surgery. Surgeons do. So I look forward to looking at all of my pictures during your second pre-op consultation. It is extremely important to always go to a board-certified plastic surgeon if you're contemplating cosmetic surgery of the face, eyes, nose, breast, abdomen, or unwanted fat anywhere in the body. Board certification is the highest level of scrutiny by your own peers. In order to receive board certification in the field of plastic surgery, which, by the way, is the oldest board of all medical specialties, dating way back to 1931, you must first pass a very, very detailed written exam, and then following that, you are privately examined by two of your senior peers on every subspecialty of plastic surgery, which includes deformed children, burns, reconstruction, breast surgery after cancer, hand surgery, microsurgery, craniofacial surgery, and cosmetic surgery. Our education is very long, it's very detailed, and in the end, it's the best for the patient to always make sure that the surgeon operating on you is a surgeon that is certified by the American Board of Plastic Surgery. I have always believed that the purpose of higher education is to follow your passion. In my case, my passion, even as a little guy, was science. I could never get enough science, so I kept studying it. And while I finally got to medical school, I started painting and sculpting, crossing medical science and artwork. The only field that does do that is plastic surgery. It allows me to go into a room and basically sculpt people. The medium is just alive. Great plastic surgery can only come from a dedicated person who loves what they do. And even to this moment, I love my profession and I love what I have chosen to do in cosmetic plastic surgery. As a result, I have surrounded myself with the best people I can find, the best nurses, the best administrators. You're in an operatory with the finest equipment available to be bought. It's an entire package, from those that meet you on the phone, to the consultation you have with me, to the surgery that's performed, and all the ancillary care it requires to give you a beautiful result and a beautiful experience.